In this video, I will cover how the neuromuscular pattern of pelvic asymmetry, or lateral pelvic tilt, can cause your groin to become painful. Additionally, I'll demonstrate a single exercise to relieve that pain. Now, before treating anything, it's important to differentiate the causes. For instance, one of my patients went through diagnostic hell. Various reasons were assumed before it was discovered that his groin pain was due to muscular activity. He even underwent a few surgeries on testicular veins, but with no success. That is, until he found me.
Now let's imagine that we have took out of the sequence all the unnecessary reasons and causes of that right groin or left groin pain, and now we can solely focus on the biomechanical aspect of that. Now when we are working with our patients, mostly we've seen that many times that improper pelvis position will cause your groin pain on the consistent basis. And usually we call that left AC pattern. It is the muscular pattern where your pelvis is being overly positioned to the right side. And this pattern mostly being caused because of the previous injuries, traumas, or other physical conditions. Now, under normal circumstances, when we are walking forward, let's say when you are standing on the right hip, on the right leg, or when you are walking forward and you are supporting yourself with your right leg, what will happen with your pelvis under normal circumstances? When you are standing on the right mid stance of your gait, your hip socket, this is your hip socket, should move to the outside like this, which will create the space for your right femur, means your right leg, to adduct to the middle line like this. And this is a desirable position for the correct mid-stance of gait. And this position will be secured by the activation of your right inner thigh muscles, which are calling the adductor muscles. But when time has come and you have to alternate to the left leg, this alternation never truly occurs once again. I'm repeating that because you are in the pattern, neurological pattern, and it means that these adductors are being preoccupied all the time and you cannot release them in the correct manner. So what you have to do in order to relieve your pain, to release these muscles, to deactivate these muscles, you have to create the correct opposite left mid-stance of gait. It means that you have to move that right hip socket to the internal middle line. You have to move that right socket to the middle line, creating adduction of that right hip. And when you will create that adduction, this is abduction, this is adduction to the middle line, you will create the automatic space for your right leg, right femur, to be in the abduction, which is exactly the ideal phase of gait when we are pushing with our leg and we are transitioning to the left side, when we are leaving the ground behind with our right leg and we are moving and shifting to the left side of our body. And this mainly should be done by your right gluteus medius, because when you are pushing off from the floor, you should do that with your right glute med. And this phase of gait usually not happening, not occurring when you are in the left AC pattern. Now, when it comes to the left hip or left groin pain, the reasons are slightly different. It's kind of be complicated to explain everything in one video. This will be the separate subject, the separate YouTube video. Now, when it comes to my case, I also used to have a right groin pain. That's why I know what I'm talking about. I had this initially when I have injured my lower back. When my left AC pattern just occurred, I felt that right groin pain, like for 1 month, I felt that pain. After that time, that period of time, the pain disappeared and I didn't feel it for many years. But when I started the PRI therapy, I started to feel it once again. So when I was entering the left AC pattern, I felt that. And when I was exiting the left AC pattern, I also felt the right groin pain. But right now there is zero pain in my right groin area whatsoever. I can run, I can do everything without any pain.
Now, before I show you the exercises, remember the patient from this video who had groin pain? After he healed with our help, he decided to open his own PRI channel, as he was already an anesthesiologist. Do you want to achieve similar results? Work with me personally through online consultation, or join us for an in-person rehab camp.
Lie on your left side with your back against the wall. Place a bolster or the cylinder underneath your left side and pillow under your head. Put your right foot on the wall and completely extend your right thigh. So I already will show you some mistake to avoid, because a lot of people will place their thigh too much flexed. So you have to put in one line your shoulder, your acetabulum, your hip, and your knee. You cannot flex your thigh in front of you, otherwise you will kill the exercise. Look at this girl. As you can see, she has placed everything almost in one line. But if you will put your thigh too much in front of you, if you will flex it, you will destroy the exercise. Put under your right foot couple blocks or blasters, couple pillows, any object that will keep your right knee on the same level as your right hip and right shoulder. Also, I forgot to mention that during this exercise you cannot extend and arch your lower back. So your lower back should be flattened or slightly rounded all the time. If you will arch your lower back, it will mean that you will rotate your pelvis excessively too much forward, and therefore you will not feel the gluteus medius. You will feel IT band, you will feel TFL, and anything else besides the gluteus medius. The next movement will be very similar that you did on the previous exercise. You have to pull this thigh, this hip, into the direction of the arrow. So basically you have to side bend your trunk and elongate the right side of your trunk. Do you see the difference? After you did this, lift your knee up by holding your right foot straight. Don't rotate the foot outside, because if you will rotate right foot outside, you will kill the exercise. After you elevated your right knee, you should feel the contraction of your right gluteus medius. After you feel this, you can transit into another step, and you can press your left foot into the ground very gently and lift your left knee up just for a couple of the centimeters or couple of inches. Therefore, you will feel the contraction and tension of your inner thigh muscle, and you will feel the contraction of your left buttock muscle. Remember, you have to contract your left side and elongate the right side. Breathe in through your nose, breathe out through your mouth. 5 times. This will be one set of the exercise. 3 times per one session.